Okay, so it is September 14th right now. And today I'm going to talk about fatigue and especially chronic fatigue and what that is and how I approach it with herbal medicine. So we will get into that, both in terms of physiology, in terms of some of the different types of things that go wrong that lead to uh, severe and chronic fatigue, and some of the systems involved and how we can support those systems with medicinal plants. So a lot of the time, this is a very common type of thing for people to seek alternative care for. We have in conventional medicine, there are a lot of remedies for short-term alleviation of fatigue, of when somebody's just having, a day where they're feeling very fatigued. A lot of the time, most people in our culture self-medicate with caffeine on a near daily basis. Caffeine is probably the most widely used substance of that sort, and I'd say well over half the people in this country and in many other countries as well use it. Tea and coffee are some of the most widely consumed beverages in the world, and a lot of sodas are caffeinated as well. So it's a very common thing for people to consume, and different cultures around the world have had different caffeine containing plants as part of their material culture and medicine for a long time. So even, for instance, in this part of the country, the only caffeine containing plant that is native here is a type of holly. And even in areas where it didn't grow, like in Western New York State, where I was born and spent some time when I was younger, the Seneca, who have lived there for a long time, they did not grow this plant. It grows further south. It doesn't really even occur very often here in Kentucky. But it was known to them. They traded for it. And similarly, I don't think there are any caffeine containing plants native to Western Europe, but once they found out about tea, it became a very widely consumed beverage. Once they found out about coffee, it became a really widely consumed beverage. So, people have traded for those things for just about as long as they have been able to get a hold of them. And so it's a, really nice uplifting sort of thing that people feel more energetic from. But the thing about it is, and about stimulants in general, is they don't really provide energy to your body. They change the way that your body handles and uses energy. So, people feel more energetic, they're more awake, they're more alert, but the energy is actually being taken from elsewhere in your body, from other sources of calories, from burning fat or burning muscle in order to produce blood sugar and releasing glycogen, which is a stored short-term storage of energy in the body. So the upshot to that is, if it's on a long-term basis, it doesn't really have that much effect compared to what it would be if someone weren't using. So it tends to be habit forming, and if people stop using caffeine, they have a few days where their energy level drops and maybe they feel pretty crummy, and then they kind of go back to their baseline. And if they start using caffeine, they have a day or maybe a few days where they feel really energetic, and then they kind of gravitate back to what their baseline level of energy is, even with the caffeine in their system. So, it's decent short-term solution, but not necessarily a good long-term solution, and certainly not a thing that is very useful when there's a chronic situation going on. So a lot of people who have these situations seek alternative care for them because often they don't fit into the category of a named disease entity. And often the choices for treatment are fairly limited to, you can take amphetamines, you can take methylphenidate, you can take caffeine, but all of that is just the same strategy of putting in stimulants to get a short-term amount of awakeness. And it doesn't necessarily make a big impact long-term. So I want to talk a little bit about what I mean by chronic fatigue. There is a condition or a defined condition, especially in the last few years. The definition of it has changed a little bit, but what people call chronic fatigue syndrome, which in recent times has been more specifically referred to as myalgic encephalomyelitis / chronic fatigue syndrome. And this is not the only thing I'm talking about when I'm talking about chronic fatigue. When I say chronic fatigue, I simply mean a tendency towards life-disrupting fatigue that goes on for months at a time. With ME/CFS, there are some more specific definitions, and this has been defined as a condition, a medical condition. It's a diagnosable disease, and so you might work with people who have this diagnosis. But as far as diagnoses go, it's kind of not very based in physiology. It's based in someone having all the symptoms in the blue box and one or the other of the symptoms in the yellowish colored boxes down below them. So not being able to participate in routine activities that were possible before coming ill, such as work, school, social life, and personal life. And that lasts for more than 6 months and is accompanied by fatigue that is often serious, not something that someone has always had, and not the result of just wearing yourself out, but something else. And often it is not made better by rest. And then the second defining characteristic of this particular clinical scenario is post-exertional malaise, where somebody, when they do exert themselves mentally or physically, they will often feel especially exhausted afterwards, sometimes referred to as crashing. This is a term that people have come up with who experience this condition. And then unrefreshing sleep, which is, kind of was also mentioned in box 1, but people might not feel better even after a full night's sleep. In other words, waking up just as tired as they were before they went to bed. And in addition to that they would have impaired memory, concentration, or that they would have symptoms that occur when standing upright, such as lightheadedness or dizziness. So if somebody has all of those things, then they're classified as having ME/CFS, which implies that there is some inflammation going on in the nervous system that is resulting in this changed functioning of the nervous system and the endocrine system that a lot of patients have described. This isn't something that can really be verified by any kind of lab test or anything like that. So it is just kind of a diagnosis that's made clinically, that's made based on presenting symptoms. And there have always been a lot of people who had this condition, and formerly it was just called CFS, or chronic fatigue syndrome. The exact cause of it is not really known and is probably not the same in all people. Sometimes this appears to be a post-viral type of thing where someone gets sick and then that's a precipitating moment. Sometimes it appears to be triggered by something else, and sometimes there is no obvious trigger for this type of thing. Historically, a lot of the time it's been associated with mono or Epstein-Barr virus infection. More recently, a lot of people are getting these types of symptoms after having had COVID, or sometimes even not after having had an obvious case of COVID, but maybe as a result of having been exposed to it. So this is a small piece of what I'm talking about when I say chronic fatigue. Maybe not a small piece, but certainly not the whole thing. There are lots of people who have chronic fatigue for other reasons, or for no known reason, but not necessarily meeting all of these criteria. So this is one way that it's looked at, and this is a diagnosis that some people might have. It's also a diagnosis that some people might some healthcare providers would say that there is no such thing, or might be completely unfamiliar with the concept of ME/CFS. And there's been a really long fight by patients, by people who have these symptoms, to have it recognized and diagnosable as a real condition, which the conventional medical world has been kind of hesitant to do without having a lab test that they can pin it to, without having something measurable where they can say, oh, we measured this and it's not what it should be. So with this particular diagnosis as it currently exists, there is no number, there is no, measurement that's happening. It's just observational. And because of that, a lot of people don't diagnose it. And because of lack of knowledge about it among healthcare providers, a lot of people don't evaluate for it or try to, assess this as a possibility. So the CDC, and well, not just the CDC as a whole, but the working group that made that sheet that we were just looking at, estimates that probably 90% of it is undiagnosed and unreported of that particular clinical scenario. So there's a lot of it out there. There's a lot of that out there, and you're likely to see some of that. There are also a lot of other scenarios where maybe somebody has had severe depression or some level of depression, and it manifests in their particular body as ongoing chronic fatigue that's not necessarily meeting that particular set of criteria, but is a life disrupting fatigue that may not be accompanied by any kind of sadness or thoughts of hopelessness or the other things that people often think of when they think of depression. Sometimes it's really just like body aches and exhaustion. And in some cases, that seems to be mainly psychological, mainly brought about by a psychological thing, a heartbreak, a loss, something like that. And in some cases, it might not be that. There's also a tendency to attribute weird stuff to depression because, it's something that there are medicines for and that doesn't really require any sort of numbers to be wrong on somebody's blood work. So sometimes if there are no numbers wrong on the tests that have been run and a person has any of a wide variety of symptoms, there's a possibility that they'll get diagnosed as being depressed. And sometimes that's really what's going on, or the best description of what's going on. And sometimes there might be better ways of explaining or describing what's happening with that particular person. My caffeinated beverage here. Now, if you have spent much time in the alternative health world, You'll probably hear sometimes people talking about what they describe as adrenal fatigue, or sometimes people use the term adrenal burnout. And what they're describing is very real, but it's not necessarily what that name makes it sound like. So most of the time with people who have these types of situation, if you actually measure the substances being produced by their adrenal glands, that you get a pretty normal finding. It's not necessarily that their adrenal glands have quit working. When people's adrenal glands actually do quit working, you do get extreme fatigue, and you also get weight gain, and you also get some other things. And it's a whole different thing. So really, the term adrenal fatigue is kind of it's not exactly literally what's going on. It's maybe more of a metaphor, maybe more of a misnomer. How can I drink coffee this late, sleep at night? Oh, well, I'm just always that tired. Let's see. No, honestly, it doesn't really have as strong of an effect on me as it has on most people. So yeah, let's see. So yeah, adrenal fatigue is a description that people use a lot to refer to this type of thing. And generally what they're talking about when they say adrenal fatigue is persistent fatigue, and persistent fatigue that is not necessarily made better by rest, and that is sometimes the result of prolonged stress. And when people started describing it as adrenal fatigue a couple decades ago, there was this idea that chronic fatigue in general was a dysfunction of the hypothalamus pituitary adrenal axis. And what that is, the hypothalamus is a region of the brain that interfaces with the endocrine system. The pituitary gland is sort of the central controlling gland of the endocrine system, and the adrenal glands, as we discussed a few classes back, are responsible for producing adrenaline, which causes an immediate sensation of wakefulness, and also responsible for producing cortisol, which is a steroid that produces a variety of behavioral and immune and neurological changes. It reduces inflammation, it makes people more wakeful, and it makes people more hungry, usually makes them gain weight as well. And people produce cortisol in the face of stress. When people are stressed, their bodies tend to produce more cortisol because they think that their body is responding as though it were about to be in a physical confrontation where it might get might receive some damage, which is not usually true of the situations we're stressed about these days, but it can be. And historically, it probably was a lot of the time. So often people feel like overexertion and stress lead them into a situation where they are very fatigued and unable to get unfatigued very easily. And so that has been described as adrenal. That's basically what people are talking about when they say adrenal fatigue. And the idea early on was that those glandular processes were not working the way that they should be, that maybe the body had gotten so used to having cortisol produced that you got a situation kind of like type 2 diabetes, where the cells were just not responding to cortisol anymore. And so, people just felt tired and listless, even though they had cortisol being produced. It doesn't really appear that that's actually true, though, because if people with that situation receive exogenous cortisol, if they get a cortisone shot or something like that, it still has the normal effect. And the amount of cortisol that they're producing doesn't increase the way you would expect it to if the body were not responding to it. So it doesn't really appear that that's actually what's going on. The idea was that, maybe the body built up a tolerance to cortisol, and then the adrenals just kind of overproduced it until they failed and couldn't produce it anymore. But that seems to not actually be literally what's going on. But what is going on is that the body is no longer able to recover the way that it normally would be from stress and exertion. And exactly why that's happening is still a little bit up in the air. There are different ideas, there are different theories. A lot of them are really more along the lines of wild guesses than theories per se. But people have ideas about why this happens, but it might not that might not end up panning out as we learn more about them. But what we do know is what we can observe directly, which is that sometimes when people have been through very stressful situations, especially in my experience, major family changes and major work changes, or sometimes work schedules that are very overtaxing, often after those types of situations, people develop severe fatigue. I've also seen very severe fatigue in conjunction with post-traumatic stress. And those are some scenarios where you see that lead up to this sort of thing, where people are feeling very fatigued and are not necessarily refreshed by resting, and are fatigued enough that it impacts their lives. And to be clear, what I mean about fatigued enough that it impacts their lives is that there are a lot of people with severe fatigue for whom there might be days or weeks where they can't leave the house, where the most effort they can exert is maybe getting up out of their bed and going to the bathroom a couple times, or on a medium intensity day, that's a very severe day. A slightly less intensive day would be, maybe they can get up and do a little bit around the house, make themselves some food or something like that, and then they're, out of energy. So that is something that is the case for a lot of people. It's the case for a lot of chronically ill people who have other things going on as well. So when I'm talking about this, I'm not just talking about this existing alone. It can also be, that somebody has some other severe illness, and part of what's happening as a result of it is that they have this extreme fatigue. So this is a frequent thing for people with autoimmune diseases, for instance, that they might just be worn out, that any energy that their body has is being put towards inflammation, towards destroying their own tissue, and so forth, and so they don't really have any energy to do the things that they want to do. So very something you'll see a lot if you start working with the general population of chronically ill people. So it's really important to learn how to manage it and how to recognize it, and how to support the body towards healing from it. The good news is that a lot of the time these things are not just, it's seldom the situation where somebody just gets hit with this extreme fatigue and stays there for the rest of their life. It's usually more along the lines of someone will lose 6 months to fatigue, and then they'll get a bit better. And then maybe later on, they'll have something happen where it starts to get bad again. And that's where they come and ask you for help with it. So, very frequently people have been through this kind of thing before by the time they're talking to an herbalist about it. But not always. And sometimes people are brought by family members and things like that too. So, So sometimes this is a result of some kind of an immune response. For instance, when people have autoimmune situations, if they have a flare up, autoimmune conditions tend to, like we talked about before, tend to go through remissions and flares. And when people have a flare, sometimes they will have a period where they have a lot of pain and inflammation that's very obvious, that fits the general image of what inflammation is like as far as pain and swelling and all that. And then they might have a long period of just feeling exhausted that might not be accompanied by ongoing other symptoms. And a lot of the time that is still inflammation. It's just inflammation maybe in the brain and the spinal cord, maybe just deeper in the body where it's not so obvious on the surface, like in the intestines, for instance. There can be a fair bit of inflammation there without it being apparent from the outside. Might not even be apparent to the person who's experiencing it. They might have, changes in bowel movements and things like that, but they might not. So a lot of the time inflammatory processes are going on and they take up a lot of energy. And they not only take up a lot of energy, but often the body prioritizes these processes because, if you were sick, for instance, your body would want you to just slow down and fight off the illness before you go on and do something else. So that same process is in effect, and you've probably experienced that before, where you get a cold or a flu or something that's really not that severe, but it makes you feel exhausted and not like doing anything. That same thing happens when someone is having an autoimmune response, even though there isn't, an actual pathogen. Their body is treating some of their own proteins as though they were a pathogen, and it's doing the whole same procedure of shutting down all the higher functions and prioritizing these ones that are just a matter of, you know, what would be a matter of defending the body, but instead it's actually more a matter of attacking it. So you see that with people who have systemic lupus. You see it with people who have Crohn's disease, inflammatory bowel syndrome, all kinds of things like that, rheumatoid arthritis, which also involves, joint pain. So a lot of the time people don't feel like moving around much. Fibromyalgia is another condition that is, basically an inflammatory condition like that is in the connective tissues of the muscles. Like chronic fatigue syndrome, fibromyalgia was a condition that for a long time, everybody the medical community in general tended to most people tended to sort of act as though it didn't exist, ignore it, say that, that's not a real disease. And then you had patients who were advocating for themselves, and that eventually changed the narrative about it. In that case, it changed the narrative partly because somebody came up with a drug that they wanted to get approved for it. And so the disease had to exist for a drug to treat it to exist. And so, that there was some change as a result of that. But before there was somebody with a lot of money who had a financial stake in the disease existing, it really got ignored quite a lot. Not only got ignored, but a lot of people got treated as though they were just malingerers, as though they were just, faking sick for attention or something like that, which honestly, hardly anyone is doing that. There are people in the world who might be doing that, but usually when people think there's something wrong with them, there's something wrong with them. And if they think there's something wrong with them and there's nothing wrong with them, that is also something wrong. So, it's usually a good idea to listen to people and in general to believe them about what they're experiencing. Not always about their interpretation of what they're experiencing, but about what is directly observable about their experiences. So yeah, in autoimmune conditions are a frequent place that you see chronic fatigue. As I mentioned before, depression it also very frequently has a chronic fatigue related component to it. Severe anxiety can as well. And you know, that kind of maybe strikes a lot of people as counterintuitive because you know, some people when they get anxious, they feel really alert, really jittery, really you know, aware of every little thing. But when people are anxious all the time, it wears them out. And so that is something that it goes along with a lot of the time. And I say that it goes along with it rather than it's caused by it because I don't actually know. I cannot really tell you the extent to which depression might actually be an inflammatory condition of the nervous system that also causes chronic fatigue, or that you know the actual thoughts and emotions that are different when someone is depressed cause them to feel more fatigued. Um, it's very hard to separate that sort of thing out, and it's also very hard to reliably observe what is going on in the nervous system physically because the nervous system is pretty well shielded by other parts of the body. So you can't just look at someone's brain and be like, ooh, your brain looks really red today, the way that you would with their eyes, you know. um, so you know, if somebody's got pink eye, you can see it. If somebody's brain is doing the same thing, you wouldn't really know. So that's something that often is going on together. Severe depression, severe anxiety, post-traumatic stress, which can involve depression and anxiety, and other things, and some other mental situations as well. Can be accompanied by severe, long-lasting, and life-altering fatigue. Closed head injuries, where someone has had a concussion, some people after that will also get severe fatigue. And so that is part of why I think that it's probably got an inflammatory component to it, is because, you know, sometimes not just like while they're concussed, but maybe months later, sometimes people will have just very severe fatigue or months long periods of fatigue subsequent to having a head injury that they did not experience before that. Yeah, because of the traumatic brain injury, I think. I don't really know. It's hard to say. I don't think anybody really knows, but it appears to be a result of traumatic brain injury some of the time, and certainly not for everybody, but some of the time. So that is a situation that you're likely to encounter. In a sort of adjacent type of situation, if someone has a history of alcoholism, like a very long history of alcoholism, especially, sometimes even after they're not using that anymore, sometimes they will have very severe fatigue that doesn't necessarily get better, or they will have periods of very severe fatigue. And I think part of that is down to decreased liver function, and part of it is probably related to brain damage. And this is true not only of alcohol, but also of some psych meds and other substances as well. There used to be a popular class of drugs called chlorpromazine derivatives. Thorazine was the most widely used one. I have often seen people who had been on Thorazine when they were institutionalized for a period of time, and then even after they came off of it, and they never really got their energy levels back. I haven't seen this in a while. I think that Thorazine is probably not very widely used anymore. Back in the early 2000s, a different class of drugs that kind of did the same stuff, didn't really do the same thing, but was used for the same clinical situations of psychosis and delusions, started to become more popular, more widely used. And I have not really, and those are called atypical antipsychotics. I have not really seen what I'm describing with atypical antipsychotics. If I did, I wouldn't be shocked because I have seen it with other types of sedatives, but I saw it frequently with Thorazine. And again, there, I don't really know what's going on. One of the things that might be going on there is brain damage from the drug, changing the way that the brain regulates the waking and sleeping cycles. Another thing that might be going on is just a very severely disarranged sleep cycle, sleep schedule. So, sleep is very foundational to your sense of what your ability to feel rested. And if you have chronically bad sleep, you will have chronically fatigued days. So sometimes you will get what is called extreme daytime sleepiness, which is exactly what it sounds like. And sometimes you'll get narcolepsy, which is when people fall asleep when they don't mean to. And then sometimes you will get just insomnia, where people can't fall asleep when they do mean to. And those things tend to run together. And a lot of these conditions, that might be one of the mechanisms of action, is that somebody's not able to sleep well, either because they're too anxious, because they're too worried or depressed, because their brain isn't functioning the way it's supposed to, their circadian rhythms aren't functioning the way they're supposed to, or whatever. And that's throwing things off on a long-term basis, especially since the first thing that people do if they have a bad night's sleep is they wake up and they have a real strong cup of coffee to try and wake themselves up. And then, if they're doing that throughout the day, that might throw off their ability to sleep the following night. And of course, it's not only coffee, it's also amphetamines and cocaine and all sorts of other things. So stimulants can actually contribute to long-term fatigue. If somebody has even a somewhat short-term habit of using stimulants, sometimes it can take a long time for their circadian rhythms and their body to recover, because it can be a self-perpetuating cycle once it's out of rhythm. Let's see. Yeah, and as Janelle points out, those prescriptions also change the feedback loop in metabolism. So they change people's tendency to want to eat, and instead of the body using that caloric energy for movement and things like that, it just stores it, and the people don't end up using it. So you don't get the uplifting, energized feeling from having consumed calories if you're taking some types of especially sedating medicines like the Thorazine that I described, but also there's another one called Risperidone. There's several of them that tend to cause weight gain and fatigue, and those can definitely change how somebody's body is handling energy, change their metabolism, and change their circadian rhythms quite a lot. And the drugs became popular with psych wards and other similar institutions because they make people more manageable. It really was not so much about how it made the patients feel. It was about that they were considered to be a danger to themselves or other people, and this made them less of that because they were sitting still. And so that's kind of been, a strategy that's been used a lot for more severe psychological issues or psychiatric issues, I should say, that has its downsides for sure. So those are all some different scenarios that can lead to chronic fatigue. Another one is a post-viral syndrome, which is kind of similar to the autoimmune one, or can be kind of similar to the autoimmune one, in that there's inflammation going on in the body, there's immune response going on in the body, maybe to the continued presence of a virus, maybe not. But while it's going on, the body's expending energy and is being exhausted. And then after it's over, uh, some viruses seem to some viruses seem to alter the metabolism, alter what the endocrine system is doing. With this most recent pandemic, we've had, there's been more of an ability to research what's going on, more of an ability to see how the different proteins in the virus are interacting with the different proteins in the cell. And so we know that the virus itself is interacting with sites on the surface of the cell that would have normally been binding sites for substances from the endocrine system, angiotensin converting enzyme sites. So that is involved with the endocrine system, heart function, things like that. So, and it's kind of adjacent to or interacts with some other substances like aldosterone, which has a lot to do with the functioning of the adrenal glands and the kidneys. So can have, an effect on metabolism, behavior, inflammation, all sorts of things like that. So that's something that we've seen a lot recently, because this has been a new condition that didn't exist, or things a lot like it existed, but not exactly it until a few years ago, until 2019. And then in the past, you saw a lot of this from mono, a lot of it from Epstein-Barr virus, where people would get sick and they would just maybe have 2 weeks where they had flu-like symptoms, and 6 months or a year where their energy just wasn't what it used to be. And a lot of the time it would be a few months where it was really bad, and then it would gradually get better over the course of a year or so. And that's something that a lot of people have experienced. You also have similar situations with some other things like Lyme disease. And Lyme disease is not a virus. It's a spirochete. People would sometimes describe it as a single-celled parasite. But it's something that is a much larger pathogen. But it does have a whole bunch of different inflammatory responses that it can provoke throughout the body. And it does can have a very severe effect on the ability to feel energy. Another situation, another pathogen, which is not common around here, but which has been studied some, that causes extreme fatigue, is trypanosomes. African sleeping sickness is what they used to call this. But this is it's a protist. It's not really a bacteria or anything like that. It's closer to, it's not even really that close to an amoeba. It's its own thing. But it's a large single-celled organism. Its cells are more like the size of a human body cell than they are like the size of a bacteria. And it's what we call a dinoflagellate. But it is this organism that is transmitted by the bite of a particular type of fly, and it causes sickness, and then it causes extreme fatigue that can last for months. And it can also sometimes kill people, but it can make people basically bedbound for months at a time, even if they recover from it. And so it was called sleeping sickness, but really it's just extremely chronic fatigue. And when I was 15, I was part of a research project at Western Kentucky University, where we were looking at trypanosomes, and we were trying to figure out how they evade capture by the immune system, because we knew that they could exist in somebody's body without the immune system really mounting much of a defense against them. what happens is they destroy cells, and then the body's immune system responds to those destroyed cells, but it doesn't really go after the pathogen itself. And so we were trying to figure out how that worked, how it was able to hide from the immune system. We didn't figure it out. Somebody else figured it out a couple years later. But they have different, they have sort of a coating of protein that can change in such a way as to sort of camouflage it from the immune system. So it's almost like the way that chameleons or octopuses can change their color, but instead of changing its color, it's changing its protein composition on the surface of the cell, which I think is pretty fascinating. But the reason I'm telling that story is because the immune response that is happening is not to the pathogen so much. It's mainly to the breakdown products of the cells themselves. So there's a big immune response happening, but and that's why there's so much exhaustion, or a big part of why there's so much exhaustion is because the body is going into fight off sickness mode and staying there. It's staying there because the pathogen is going unchecked and going around and destroying tissues in the body, which the immune system continuously has to respond to these destroyed tissues. And so the immune system acts like the second day of the flu, but it acts like that for a long time, months, maybe longer. So that is also similar to what's going on when somebody has an autoimmune condition and there's some destructive autoimmunity causing breakdown of human proteins, and then the immune system going after those human proteins and probably releasing some sort of hormonal messages in the body that are telling the body to rest and recover rather than having energy. So there are probably multiple things going on whenever somebody feels fatigue. It's not just one thing. It's not just, oh, your adrenals are burned out, so now you feel fatigue. It's not even just a matter of, it's not any one substance being thrown off. It's a complex neurological, endocrine, and external factors type of situation. So it plays into a whole bunch of, you have a whole bunch of different things going on at once that add up to severe fatigue. And some of it's the nervous system, some of it's the endocrine system, and some of it is the immune system. So when somebody comes to see you and they're experiencing extreme fatigue, you have to try and address all of those things. And you have to try and address them all at the same time. Otherwise, things will get a little bit better and then they'll get bad again. And then they'll get a little bit better and then they'll get bad again when you try something else. So you have to kind of address it all at once, multiple systems, and treat the whole person rather than just treating a symptom the way you would with caffeine or Vyvanse or Ritalin or anything like that might temporarily make them feel better. If you're doing it with herbal medicine, it would be more like caffeine or ephedrine or green orange peel extract, coca leaves, any of those things. It would be stimulant herbs. They'll help at first. They'll help for a little while, but they won't make it all better, and they won't make it stay better. So as soon as somebody comes to see me and they're talking about fatigue, the first thing that I start wanting to know more about and find out more about is sleep. Not simply how much time do you spend in bed, but how is it for you falling asleep? Is it difficult to fall asleep? Do you wake up feeling more rested, or an hour after you wake up, do you feel more rested than you did at night before you went to bed? Do you wake up often when you sleep? Do you have trouble getting back to sleep once you've woken up from a sleep, and so forth? So trying to find out stuff about that situation. With chronic fatigue, that's often not the source of the problem, but it often is a barrier to getting better. So even if I know that somebody has chronic fatigue as a result of something in particular, I'm still going to ask these questions, and I'm still going to try and work on sleep hygiene, which is like, sleep conditions, and possibly nervines, hypnotic nervines, things that help them sleep better, to improve their quality of sleep. Because without that, things are very unlikely to get better, or at least they're going to take a long, long time to get better. And there's going to be a lot of needless suffering on the way. So it's normal for people to wake up during the night. Like it's very common for people to wake up, use the bathroom, maybe just kind of take note of their surroundings and go back to bed. It's even common enough for a lot of people to be awake for 10 minutes or something like that, 15 minutes in the middle of the night. It's not that unusual. Historically, people would often, wake up, check on their livestock, check on their kids, things like that, and then go back to sleep. And so that's a normal part of how humans sleep. What's not normal is if somebody wakes up and they're trying to go back to sleep and they just can't go back to sleep. You get a lot of the time people will say something like, I fall asleep, but then I wake up 2 hours later and I can't get back to sleep the entire night. And so then you get a 2-hour night of sleep, and that's no good. That's almost worse than none. It's not really worse than none, but it's not much better. So that can make people feel really exhausted, even if it just happens once. And if it's happening night after night, it can make people feel dangerously exhausted. It can make people unsafe to drive. It can put an undue strain on their heart, and so forth. So, and then the other thing is how easy it is for people to fall asleep in the first place, and what happens when they try to fall asleep. A lot of the time, people with chronic fatigue will be out like a light really quickly. Some people won't. Some people will lay there with their mind racing, thinking about all sorts of things, often, latching on to trivialities and having strong feelings about them, like getting embarrassed about something stupid they said in a conversation 2 years ago or whatever. And that's definitely a sign that something is going a little bit wrong. And sometimes that's a result of someone having had too much sugar or too much caffeine or something like that to help them stay awake during the day. And sometimes it's not that. Sometimes it's just kind of a result of maybe being too distracted during the day to have their own thoughts. And then when things are quiet and everybody else in the house is asleep, their brain is running through all these thoughts that they probably would have had earlier in the day if they hadn't been so overwhelmed. So that's something that can partly be addressed sometimes by changing circumstances, by, maybe slowing down during the day, taking 10 or 20 minutes to meditate during the day, something like that. And of course, not using so much sugar and caffeine and that sort of thing. Sometimes, though, people just have a really hard time falling asleep. And there are some good herbs for helping people fall asleep. And usually the first thing I will start with is something like skullcap and chamomile in equal parts, or motherwort and chamomile in equal parts. And that slows down the heart, slows down the breathing, relaxes the muscles, and helps people fall into a nice, normal state of sleep that doesn't make them feel like they're in a stupor. It doesn't give them weird dreams. It just relaxes them and lets them sleep. And that will often help people stay asleep too. Sometimes people lose sleep or wake up from sleep because their body is not all the way asleep. They're doing a sort of watchful sleep, which is something that people start doing as a result of various stresses. You know, for some people, it's just a matter of like having little kids and, you know, constantly keeping an ear out for if the children have woken up or something like that. For some people, it's more of a post-traumatic stress type of situation or not feeling safe type of situation. And that's often something that people have carried with them from like an unsafe childhood. So there are all kinds of, you know, psychohistories, all kinds of different life situations that can lead up to that. But if somebody is on edge, even when they're asleep, then sometimes these calming remedies like what I'm describing can be really helpful for that. Most people need 8 hours of sleep. A lot of people will tell you, I only really need 6 hours of sleep. And that's usually not true. Usually they really do need 8 hours of sleep. And a lot of people need 10. So, you know, I think that because we have sort of a cultural obsession with productivity and a sort of stigma around the idea of laziness or around the idea of people not doing their share of the work, whatever that means, that a lot of people push themselves to get by with the bare minimum amount of sleep that they can get by with. And the really negative thing about that is the bare minimum of sleep that you can get by with when you're 40 is not the same as it was when you were 19. Usually it's usually you need more sleep, and you know, you needed the sleep when you were 19 too, but it was easier for you to push through. And you know, if you have to pull an all-nighter as a middle-aged person, it doesn't feel the same as it did when you were in college or whatever. It's a big difference. So a lot of the time what you have is people pushing themselves to wake up and be productive and only need the amount of sleep that they needed when they were half the age they are now. And sometimes it just doesn't work. Sometimes people just need to kind of, you know, realize that life has changed, your body has changed, your stamina has changed, and you need to do something different. Now with chronic fatigue people, they're often past that point where, you know, they've done all the pushing themselves that they can do, and now things have collapsed to the point where they can't push themselves anymore. So in that situation, sometimes people really need 12 or 14 hours of sleep. And sometimes, you know, waking up after 8 hours feels bad because their body just really, really isn't ready to wake up yet. So, you know, trying to reassure people that if they need 12 hours of sleep, they need 12 hours of sleep, and there's no way to shortcut that is sometimes really affirming, and sometimes really, you know, hearing it from you might really give people the permission to take care of themselves that they need to have. Yeah, so Becca mentions that just kind of focusing on your breath as you're trying to fall asleep is also helpful in addition to the skull cap. And I agree, I do the same thing. I breathe in slowly as I count to 4 and then breathe out slowly as I count to 4 and do that until I fall asleep sometimes if I'm having trouble falling asleep. And that can be really helpful. So yeah, just, you know, making people aware of the fact that they might just need to get an extraordinary amount of sleep, and that is not necessarily a lifetime situation. You know, you can say to somebody, you know, right now you might just need this amount of sleep, and 6 months from now it might not be that way anymore. But there's no point in trying to pretend like it's not that way now, or trying to push yourself to get up. Uh, I mean, unfortunately, there might actually be a point in doing it because most of us have, you know, jobs and things like that, family obligations and so forth that we have to do our best to take care of. But and it can be very hard to, you know, not everyone has the resources just to not do those things. But I think sometimes, when people are experiencing extreme fatigue, extreme chronic fatigue, it's just kind of, if at all possible, better to be non-productive before it gets worse than non-productive after it gets worse. So it's important to be as realistic as possible about what the options and what the consequences are, just so that everybody kind of knows what they're getting themselves into, and what the outcomes are likely to be. Like I said, frequently, chronic fatigue is somewhat self-limiting. People will have periods where it is bad and then it will get better. For some people, it's not like that. Some people struggle with it for the rest of their life, whatever that is. And but still, even though it might be a problem that they're continuously having to manage, it is something that herbal remedies can actually help a lot with the management of, and to make it a better outcome than it otherwise might have been. So helping someone to get sleep is really important. Skullcap and chamomile is something that I like. Either of them by themselves is an okay thing to do as well. I said this before, but some people really like valerian. I'm not a huge fan of valerian for helping people fall asleep. I might use it if some other stuff didn't work, but I don't really consider the sleep that people get while they have used valerian to be quite the same thing as normal sleep, because a lot of the time it involves really vivid dreams and racing thoughts and things like that might not be so relaxing. Physically, environmentally, nutritionally, there's a lot that can be done for promoting better quality of sleep, more restorative sleep. And one of the most important things is having a comfortable place to sleep. Unfortunately, a good mattress is really expensive. And a lot of the time, people who spend a lot of time in bed have beds that get kind of worn out. The springs get worn out and things like that. And the beds can become problematically uncomfortable, to the point where maybe the person is straining their back, harming their back or their other parts of their body by sleeping in them. And that can be a big issue. That can be something that can be an actual barrier to healing, or something that can lead to, pain. And then, of course, pain leads to people doing stuff to manage the pain, which might make the fatigue worse. But trying to have a comfortable place to sleep is really important. A clean, comfortable place to sleep can be really helpful to getting more restorative sleep. Getting long enough sleep is important. Getting quiet enough sleep is important too. And of course, for some people, breathing during sleep is an issue. There are a lot of people who have chronic fatigue that is contributed to by the fact that they're not able to breathe properly while they're asleep. Some people have CPAP machines or BiPAP machines that push air into their lungs while they're asleep, help with sleep apnea. There are herbs that help with sleep apnea as well, mostly respiratory support, anti-inflammatory herbs, sometimes really helpful. But if somebody is not breathing right while they're asleep, that can be a problem. And it can be something that is hard for people to know about. I mean, a lot of people don't know that they snore, that they have sleep apnea, anything like that, if they don't sleep with somebody else, because, it happens while they're asleep, so they don't ever hear it or anything like that. But some people will stop breathing for several seconds frequently throughout the night while they're asleep, and that can really interfere with the ability to get a good night's sleep. It can also put a strain on your heart. There are cell phone apps now that will kind of listen to your breathing and supposedly tell you if you are having sleep apnea and if you're snoring and things like that. They're not diagnostic tools. They're not always right. They're not necessarily something you want to hang your entire conclusion on, but they might give you grounds for further investigation. You know, if they say that you have sleep apnea, you might want to get that checked out if possible, because you know it's well, it's not accurate enough to make a full conclusion on. It is grounds for suspicion at least. So this question here is, are there herbs that help prevent sleep apnea? Yes. So a lot of the time, sleep apnea involves inflammation of the adenoid glands. So anti-inflammatory herbs and lymph supporting herbs, like ginger, like sarsaparilla, can actually help with sleep apnea some of the time. Horehound and mint also helps sometimes as well. And they're just kind of cooling to the respiratory system and decrease inflammation in the respiratory system. And so those herbs can sometimes help with sleep apnea, depending on how intense it is. You know, sometimes that helps and sometimes not. But you know, they're definitely worth a try if you know that that's a situation that somebody's dealing with, or if you have reason to believe that it's a situation that somebody's dealing with. People are breathing through their mouth while they're asleep. That's often also a sign that they're not as able to breathe as easily. Like maybe they're congested, maybe they have some inflammation in their sinuses or in their glands. You know, maybe not, but sometimes that's the case, that they're breathing through their mouth because they can't breathe through their nose so well. So that's something that, you know, if that's going on, people will often know that that's going on because they wake up and their mouth's all dry and that sort of thing. So that's something that you stand a better chance of being aware of. So those things are important for promoting sleep. Sometimes avoiding sugary foods or even high carb foods later in the day can be helpful for people who have trouble sleeping. So eating something that is more calorically dense, like protein and fat, and less likely or lower glycemic index, less likely to cause a spike in blood sugar, is going to be more conducive to being able to fall asleep. And for a lot of people, that makes no difference. But for some people, it does make a difference. So if the other things that you're doing aren't working, that might be something to look into. Getting people to change how they eat is often really difficult. It's often really necessary and really helpful, but it's often really difficult. You know, I have seen people consciously choose to die rather than decide to change how they ate. And it's hard to believe that that is, you know, that someone with full knowledge of the consequences would make that choice, but I've seen it more than once. So it's, you know, some people are open to changing their diet and some people are not. Some people are more inflexible about it. So that's just something to be aware of, you know, and make the suggestions, emphasize the suggestions, but, you know, don't beat your head against a brick wall if you can't get somebody to change how they're eating. But at the very least, not eating sugary foods, especially later in the day, can be really helpful to someone not being too hyped up once it's time to sleep. So all of that is, you know, the changes other than just giving somebody a calming herb can be really helpful. They can also be really hard to get people to enact, especially people who don't have a lot of resources. You know, if you tell somebody you need to have a quiet home to sleep in and you need to buy a new mattress that's more supportive to your lower back, And, if they're broke and they have a big family that they live with, there's just not that much they can do about that. So, there again, give them the information and trust them to do the best they can with that information.
Andrew, can I ask a question?
Yeah.
With a lot of these sleep issues, is inflammation, kind of across the board, a major root cause to most of these problems, like sleep apnea and things like that, that cause sleeplessness? Would that be a safe assumption?
It is, I don't know that I would call it a root cause, but it's in there. It's an ingredient.
Okay.
It's definitely an ingredient. Which brings me to my next point. So inflammation is very frequently a contributing factor in chronic fatigue. It's, part cause, part effect, but because, when you're not sleeping, it's hard for your body to clear inflammation. It's hard for your body to kind of reset things with your nervous system and with your endocrine system and with your immune system. And then the inflammation itself, part of the way that your body responds to the inflammation is by producing anti-inflammatory steroids, which can cause sleeplessness, which can then cause exhaustion. And also, being in pain doesn't feel very good. At least most people don't like it. And that can affect, someone's ability to sleep and get rest. And that's a very, very big issue for a lot of people is, they're just too uncomfortable to rest properly. And that by itself ends up wearing them out. And then on top of that, you've got everything I said before about, the body acting like it's sick and being in a mode where it prioritizes the immune function rather than the usual productivity. And then in addition to all of that, you have the fact that inflammation is potentially affecting the nervous system and changing how the nervous system works. So a lot of the time you might have inflammation in the spine, in the brain, things like that, that can really lead to people being run down and their the lack of mental clarity. If you look at the thing that I shared earlier, lack of mental clarity and concentration, impaired memory or ability to concentrate is very frequent. And so are perceptional things like lightheadedness and dizziness, lack of proprioception, which is where you can't as easily or as accurately tell where your body is in space. Maybe you have less balance. You also get some autonomic dysregulation when there's inflammation of the nervous system, which might show up as things like irregular heartbeat, things like that. So these are all things that can be associated with the myelin sheath of the nerves being inflamed. That's what the encephalomyelitis means. It's that encephalo is like in the head, and then myelitis is inflammation of the myelin. Myelin is a protein coating that covers some nerves in the brain and also elsewhere in the body as well. But especially in the brain, it's referred to as white matter, and it's a major component of brain tissue. So having inflammation going on in those systems is very consequential to the amount of fatigue someone feels, the amount of exhaustion someone feels, the amount of mental clarity someone has or does not have. And then on top of that, you've got the inflammation elsewhere in the body being a contributing factor by interfering with sleep and by making a simple thing that somebody might be doing more of an exerting thing. So for, you know, a perfectly healthy person, going to the grocery store and buying some vegetables is not that big of a deal. But for somebody who has an autoimmune condition with lots of inflammation, like fibromyalgia or rheumatoid arthritis or something like that, going to the store and buying some vegetables is like life or death quest kind of thing. You know, it's like fighting a battle or something like that, and it's really exhausting because of the amount of inflammation and because of the amount of discomfort that their body would be feeling. So reducing inflammation is one of the most important things to do for chronic fatigue. Can you have both? Yeah, you can have, to me, fibro and rheumatoid arthritis are not necessarily exactly two separate things. It's the same process, which is destructive autoimmunity, happening in similar tissues, connective tissue, in different areas of the body, in the muscles in fibro and in the joints in rheumatoid arthritis. So they're comorbid a lot of the time. In other words, people have both of them a lot of the time. And also in my worldview, they're really not separate things. They're just kind of like, you know, kind of like the same thing in different areas. Sort of like having a sunburn on your back and also having a sunburn on your face. It's not really two different conditions. It's the same process happening in two different parts of the body. So yeah, those things are very common to have together and very closely related to each other and very exhausting and can make otherwise normal things pretty tiring. So when you're working with somebody that has extreme or chronic fatigue, reducing inflammation is really important. Usually, here's how I approach that. When I first start working with it, I give them a combination of different types of anti-inflammatories that includes some steroidal anti-inflammatory herbs, some herbs that contain steroidal saponicides. And this would include ginseng, it would include trillium, it might include wild yam, which contains diosgenin. And that's one of the components of the formula. And then I would also use some cyclooxygenase inhibiting anti-inflammatories like ginger and or turmeric. And I would also include some salicylate containing anti-inflammatories like willow bark or sweet birch are two of the ones that I use most frequently. Wintergreen and violet are also in that category. I would use something from that category. And also, I might use frankincense, which is a different kind of anti-inflammatory. So a wide variety of different mechanisms of action to reduce inflammation. After the first week or so, I'm going to want to take that steroidal component out because ongoing use of that can have other effects for other effects that are not what you want when dealing with chronic fatigue. But having this broad spectrum, multifaceted inflammation control is really important. It's possibly, for some people at least, more important than anything else as far as getting their chronic fatigue under control, especially in people who have chronic fatigue that is related to autoimmunity or that is related to a post-viral situation. That's usually the biggest component of what's going on. That's usually the thing that makes the most difference. And also the thing that they have to keep doing for the longest. The sleep cycle stuff is really important too, but a lot of the time, once that gets fixed, it stays fixed. The inflammation, you might have to wage an ongoing struggle against, possibly indefinitely. but you should be able to get it under control. So usually with that sort of thing, I make up a combination of anti-inflammatories, and then I give them a really large dose of it to start out with. And by a really large dose, I mean something like 5 milliliters 3 times a day. I've done as much as 15 milliliters 3 times a day of a compound like what I just described to just bring down the amount of inflammation in somebody's body. And that by itself is often a huge change for them in how they're feeling, and often really just kind of allows for healing because, like I said a minute ago, the inflammation isn't necessarily a root cause. The inflammation is usually caused by something, but it is a gatekeeper. It is something that keeps people from being able to get better. The deranged sleep cycles are often also caused by something else or secondary to something else, but while they stay messed up, it's hard for things to get better. Unfortunately, when there is an inflammatory process going on, sometimes the cause of it is somewhat inscrutable. Somebody's immune system has decided that their joints aren't human and wants to attack them, and it can be very hard to get that to change. Hang on just a second. Yeah, they're very intertwined, and the various different autoimmune situations very intertwined, and changing what you're doing, eating a better diet can sometimes help. Taking remedies for inflammation is often really important. Some of the conventional treatments, they help some people and they don't help some people, but they often come with a big cost in terms of, we got something that will help with your rheumatoid arthritis, but you might also die of a cold, and that's it's a difficult that can be a difficult choice for people to make. But I think with herbs it's usually possible to bring the inflammation down a lot without putting the person at risk of anything really weird happening. So that's often a huge component of it. So you want to help with sleep. And in addition to helping with sleep, you want to support the nervous system. So for that type of thing, I would often have the chamomile and skullcap, but I might also have it in combination with an herb called bacopa or centella, both of which are just sort of restorative to the nervous system. I also use nettle in that capacity. And then not in the same combination with the sleep stuff. Sometimes in the morning, I would give people a compound for their nervous system that contains Tulsi. Tulsi is a variety of basil. Some of it right here, and I love it so much. It helps with a lot of stuff, but it's very uplifting and it's very nurturing and soothing to the nervous system. Nutrition for the nervous system. The nervous system basically runs on fats and oils, so getting good quality fats in the diet, like fish oils, grass-fed butter, coconut oil is pretty good. Avocado is good. Olive oil can be good if it's good olive oil. So all of those things can be really helpful. They have a protective effect on the nervous system, and they're nourishing to the nervous system. So supporting the nervous system and reducing inflammation are the two biggest things in my experience, and I'm including promoting good sleep in the part of the supporting the nervous system strategy. Hang on just a minute, I'll be right back. All right. So in addition to supporting the nervous system and the reducing of inflammation, it's really important to support the immune system in a lot of situations. And that doesn't mean stimulating the immune system, it means modulating the immune system, because if anything, usually what you have is a situation where the immune system is overactive, the immune system is doing things it shouldn't and causing chaos and destruction. As previously mentioned with the destructive autoimmunity in the connective tissue in various different parts of the body. I really like turkey tail mushroom for this situation. Reishi mushroom is also good. And I very often use an herb called rock tripe as well. Rock tripe is not really a commercial product. It's a lichen that grows on boulders and cliff faces. And it contains some wonderful immune modulating substances. It contains antihistamines and steroids, and then it also contains alpha and beta glucans, which are special starches that help the immune system to function better. And it probably contains some other stuff that I don't know about because it really just hasn't been all that researched. So those things are good. Medicinal mushrooms. For most people, oats are also helpful. Just like eating actual oats. Oats don't contain gluten, but they are usually processed on equipment that does also process gluten. So that's something to be aware of if you do have to strictly avoid gluten, that there are certified gluten-free oats that are not processed on equipment that also processes or stored in facilities that also store gluten-containing grains. But oats contain some of the same polysaccharides that are in medicinal mushrooms that are, as far as we know, responsible for a lot of their medicinal properties. So eating them is also soothing to the digestive system, which is often, when there's inflammation in the body, there's often inflammation in the digestive system. When there's stress in the body, there's often upsetness in the digestive system in one form or another. So having something that's demulcent and soothing to the digestive system can help to be soothing to the whole body. And oats traditionally are considered to be like a very mild nerve tonic, like a food for the nervous system. Supposedly feeding horses oats makes them calmer, for instance, which I haven't actually really noticed, but it is something that people do say. But it definitely does contain some of these polysaccharides that might have an immune modulating effect. So reishi, turkey tail, rock tripe are all good medicines in this situation. And then oats are a good food to have, and mushrooms, culinary edible mushrooms, are also good. There are some immune herbs like astragalus that don't tend to be associated with immune flares. You don't want to do something like echinacea that would, or another one is baptisia, that would be really provocative to the immune system. You want just things that kind of calm and soothe the immune system. And you want herbs that help to move the lymph, because lymph is the lymph system is a big part of the immune system, and stagnation in the lymph system can go along with chronic inflammation. It can go along with lack of movement, and it can be a really big barrier to returning things to normal for the nervous system and the immune system and the endocrine system. So herbs that help with moving of the lymph can be a good thing to combine with the immune supporting herbs. I have used watermelon seeds in this capacity. Poke root is a really intense herb for this. It's not something I use most of the time, but use that occasionally. If there's very obvious signs of like lymphedema, swelling, and lymph retention in the limbs, I'll use that for a little while. But the herb that I use the most for moving the lymph in the body is Smilax, Sarsaparilla, which we've seen on some of our herb walks before, and which is also a very, very common herb in my part of the world. It grows in young woods, especially. It's a woody vine, and the underground part of it is what's used. I call it a root sometimes, but it's really like the underground stem, which looks a lot like the above ground stem, except it's not green and it doesn't have leaves on it. But in order to get the medicine out, you have to cook it a long time. You have to chop it up and decoct it for, I usually decoct it for 40 minutes, and then I let it sit overnight, and it will extract a reddish color from these pale, almost white roots. And that is a good lymph moving, a very safe lymph moving herb. It's not as intense as the poke is. The poke will cause diarrhea and other things like that. The sarsaparilla generally doesn't, but it does move a lot of fluid through the body and is very safe. It's not something that is associated with any real kind of toxicity at any particular dosage. So it's a good one to use for that. Spicy things also tend to move the lymph some. Garlic, cayenne, so they could be part of that too. And this is more noticeable in some people than others, but especially if somebody is very sedentary, not able to move around a whole lot, sometimes they will get like swelling in their hands and feet from retained lymph, sometimes even pitting edema in the feet, where you can press on the foot and it will leave an indentation that takes a couple minutes to go away. So that is something that is another system, or that's part of the immune system really, but that's something that has to be supported as well. Along with that, another thing that is an intervention that helps to support that and helps to build energy in general is very gradually increased amounts of physical activity. So the idea there is that somebody does a little bit of physical activity every day and tries to slowly increase the amount of physical activity that they're doing. And the thing about that is sometimes people will start feeling a lot better and want to do all the things that they haven't been doing. So they'll be like, oh, the inflammation is gone. I can get up, I can do the dishes, I can clean the house, I can go to the store. And pretty soon they've done what they would be doing in a week previously. And they feel okay maybe, or they feel tired after doing all that, but it seems normal. And then the next day they are getting that post-exertion malaise, as the CDC called it, crashing, as people often refer to it. And that can take a long time to recover from. So it's best to avoid that situation by just gradually increasing the amount of physical activity that somebody's doing, even if they feel well enough to do more, because it can be easy to misjudge how much energy you actually have to put towards things. I've seen a trend on the internet of people talking about how many spoons they have to spend when they have chronic fatigue. And for some people it might work that way, but for a lot of people it's like you don't know what you have, and you don't know how much energy is going to take to, how much energy expenditure it's going to take to cause you to crash the following day. So, it's best to play it a little bit safe with that sort of thing. And not necessarily extend yourself to the limit of your abilities. Although it's very tempting to do so for someone who as maybe is just starting to recover from being fatigued for a very long time. So, warn people about that, because they will start feeling better, and they Hello. Is everybody still here? I don't know what just happened. I
I'm
think I
here.
didn't have the yeah, I
I'm
got
here.
abducted
They
by
just did
aliens.
that
No,
to me
I'm
too.
here.
Do you
yeah,
have
no,
updates? I just updated 8 apps.
I don't know. Mine just it just said I didn't get any message like that. It just said connecting. I like well, it said waiting, and then it said connecting. So it disconnected me for reasons that I am not quite clear on. So
I
I
thought
walked
the
outside to take
aliens
care of the
took you.
reception thing.
You know what? That Coast Guard that just flew over me looked like a lantern fly.
Oh yeah. No, I don't know. I just came outside because I thought that maybe it would help with reception or something like that. But that might not have been the issue at all. So anyway, where was I? Yeah, gradually increasing people's level of activity, and also that they might have lost some muscle tone and some strength through inactivity. And so sometimes people need to be careful also about like the assumption that they would be able to lift things as heavy as what they might have been used to before or something like that. So people just kind of need to start off a little slower and ease into that sort of thing, rather than trying to go to their full workload or what would have been their full workload before, because they really might not be up for that. And that's, an important thing to warn people about, an important thing to let people know that they will get back soon, that it just takes a little bit of time. And that if they're patient, it won't take as long. And if they're impatient, the healing process will take longer. And so if they just kind of, take it easy like they need to and accept where they're really at, that's going to facilitate a faster healing than if they try to throw themselves fully back into what they had been doing. If they try to throw themselves fully back into what they had been doing, maybe it'll work out, but there's a good chance that they'll end up, crashing again and having to take it easier for longer as a result of the overexertion.
Andrew, would ginger be a good lymph mover? You were talking about moving lymph earlier.
Yeah, ginger is a good lymph mover, and it is also a pretty decent anti-inflammatory as well. So it's a good thing to have in the mix there, um, for a couple of different reasons. And it's a wonderful digestive herb, and it's good for inflammation in the digestive system, which is often kind of a hidden symptom in people that have chronic fatigue. Sometimes it's noticeable and sometimes it's not. So depending on what the underlying stuff is, which is very variable.
Thank you.
Yeah. So let's see. Supporting the nervous system, supporting the immune system, endocrine system. The endocrine system is another area that it, kind of ties in pretty closely with the nervous system, but sometimes taking something in the night for mostly for nervous system and sleep, and then taking something in the morning for endocrine system and energy, maybe an uplifting nervous system herb like Tulsi, maybe something like ginseng that helps the nervous system to give the body the energy that it needs. I mean, the endocrine system to give the body the energy that it needs, because the endocrine system really is what the endocrine system kind of hands out the energy from the digestive system to different systems in the body. So the endocrine system determines whether the calories you digest end up being deposited as fat, turned into tissue, or spent as energy. And so if somebody is not getting as much energy that they can spend as energy, then an herb like ginseng can really help with that. Blue cohosh has also been used in that way in the traditional medicine here in Kentucky. I think in the commercial version of herbal medicine, blue cohosh is mostly seen as a fertility herb, something to induce labor and that sort of thing. And it's good for that when it's called when the underlying conditions are right. But it is also something that can be taken in small amounts in kind of the same way that ginseng can for promoting energy and stamina. So that's another one to be aware of. And then in addition to that, getting adequate nutrition, getting adequate B vitamins and iron. If B vitamins or iron are deficient, then which either of them can become after an illness, especially, but also after injuries and in various other situations as well. If those are deficient, if those are not at optimal levels, it can cause a lot of fatigue. And even if they're just a little bit off, it can keep someone's recovery from being what it otherwise could be from a long-term fatigue type of situation. So very multifaceted, a lot of different things to consider. But this is something that you're very likely to have to help people with, and it is something that a holistic, whole body, multi-system approach is really necessary for, or is really going to produce a lot better results than just a pill for fatigue or drowsiness or something like that would maybe just be a little more one-dimensional. That often doesn't work on any kind of a long-term basis. So it's something that a lot of people come to herbalists for, and it's something that herbal remedies can be really helpful with. So any questions about any of that? Let's see. Would you please clarify the loading dose of the anti-inflammatory herbs again? Up to how many milliliters per day? Up to 45 milliliters per day. I said usually what I do is start with 5 milliliters 3 times a day, but that I have done as much as 15 milliliters 3 times a day. And if that sounds like a lot, it kind of is a lot, but it is also, you know, it's safe with those particular herbs. So it's, one of the nice things about herbal remedies is that you can give somebody really large doses of really well-tolerated substances and sometimes get, effects that you would not be able to get with smaller doses of more powerful but less well-tolerated substances. I am back inside the clinic now, and it has not shut down on me. Okay, so that's good. All right. Glad to hear that the stuff I have made you is helpful, Amanda. So yeah, this is it's a big subject. There are a lot of different systems involved. I mean, all the systems are involved really, but a lot of different systems that kind of potentially gatekeep recovery. And so it's complicated and multifaceted, but it is an area where plant-based remedies can really shine, because they don't have very stiff competition. Okay, the dosage for sarsaparilla root is usually I would start out with like 5 milliliters per day or so with that. And there was a question of, am I seeing long COVID at the same rate as a few years ago? I wouldn't say at the same rate. I'm not seeing new cases at the same rate that I was seeing them when there was a higher incidence of COVID itself. But there's still plenty of it around. There's still plenty of it around, and I'm also seeing some people that I have, you know, been seeing for a year now. So there's a lot of people that have had it for a while, and that are still dealing with different issues. Some of the issues get better more quickly than others. And like the fatigue issue sometimes takes 6 months to a year to be back to normal. So I'm still working with people, even though they've been making progress all along, that I started working with a year ago. But there are also other issues that maybe involve more organic damage or more damage of tissues that are not as easy to recover from. Am I seeing more COVID in the recent weeks? Yeah. In the last 3 weeks, I've definitely been seeing an uptick in COVID here locally, which, I mean, I kind of, you know, back to school, with back to school happening in the beginning of August, I just sort of expected that would be the case, and was not surprised. What I've been telling people about taking boosters is that, you know, it's not really not really in my purview to recommend for or against a conventional treatment like that. But I do, you know, let people know that there is an increased incidence in COVID, that we're not seeing the increases in hospitalizations and deaths that we have seen with other similar increases. So it is, you know, more tending towards milder cases, but that it, you know, but that there is more of it out there, and, you know, they can make their own decision as far as that goes. But let's see. So yeah, that's my story on chronic fatigue, including but not limited to people with chronic fatigue syndrome in the stricter sense. And I also wanted to tell you that on the 8th, I'm going to be doing an herb walk with year 1, but all of you would be welcome to come too. And this one is going to be at Heisel Farm Park again. So hopefully, you know, if you want to come to that, there will be some good fall plants to see. So that's coming up soon. Also, if you haven't sent me payment for September yet, and you are planning to do so or in a position to do so, don't forget. And yeah, if anybody has if you do start working with anybody with this kind of a situation and you want any help with it, let me know. Just let me know, and I would be delighted to help any of you through working with somebody with this kind of a fatigue related situation. And you know, like I said, usually it's possible to get really good results.
It's such a hard thing in this like noisy world, I think,
Oh,
to
it
like
is,
help
for sure.
people with chronic fatigue and
Mhm.
sleeplessness. You got TVs and social media. It's such a hard thing because those habits are so ingrained
Sure.
in us these days.
They really are. Excitement and entertainment are a big part of a lot of people's lives. And of course, productivity is a big part of a lot of people's lives. And so, you know, working around all the cultural dimensions of it is plenty challenging.
Living slow is so hard to get through to people's heads. Like it makes them feel
Yeah.
lazy, but that's like my parents. I'm like, you guys just need to be slow. You don't have to go to all these things and go to places and do the things and buy the things. Just slow down.
Yeah. Yeah, for sure. All right. Well, any further questions for tonight? Well, thank you all for coming, and I will talk to you again in 2 weeks.
Thank you so much.
Thank you.
Good night.